Hi, I'm Fiona Cunningham. I'm a clinical psychology doctoral student at Fielding Graduate University, and I come to you today from Newfoundland and Labrador, Canada. I'm going to speak about the maternal health indicators that predict estimated rates of modern slavery. There is no universally acknowledged definition of modern slavery. You've perhaps heard of similar terms, trafficking in person and human trafficking. Modern slavery is an umbrella term referring to all forms of coerced exploitation, including sex trafficking, forced organ donation, forced marriage, and all forms of compelled labor. It is the third most prevalent crime worldwide behind drugs and arms, affecting 40.3 million estimated victims, and is currently a $150 billion industry. The majority of modern slavery victims are female, with females accounting for 96% of trafficked victims. Further, gender inequality is a global problem that profoundly impacts both rates of modern slavery and mortality and morbidity among mothers and infants. Therefore, we hypothesized that poor mental health outcomes would predict higher estimated rates of modern slavery. We used data sets from the United Nations Development Program, the World Health Organization, and the Global Slavery Index, which provide country-level data. Predictors of women's maternal health were used to predict modern slavery. Regression analysis with backward removal was used to find the best maternal health predictors of the prevalence of modern slavery. Our predictor variables included maternal mortality, child marriage, proportion of births attended by a skilled health personnel, unmet family planning, adolescent birth rates, antenatal health care, and contraceptive prevalence. As hypothesized, maternal health predictors had a significant relationship to the prevalence of modern slavery. All models were significant, with the full model explaining 21% of the variance in the estimated prevalence of modern slavery. The final set of predictors predicted modern slavery and included the predicted variables of maternal mortality, child marriage, and antenatal health care, and explained 22% of the variance in the prevalence of modern slavery. In conclusion, countries with more gender inequality, as measured by maternal health factors, also have a higher estimated prevalence of modern slavery. Beta weights reveal both positive and negative associations between indicators of gender inequality and modern slavery. Some we expected, some we did not. There are current limitations to this research, including the widespread gaps in a country's domestic implementation of their international obligations to prohibit human exploitation. Further, due to the illegal nature of modern slavery, statistics are likely underreported and to be incongruent across countries due to the unique country-level legal definitions. We suggest that further research, therefore, is needed to understand the complex relationship between these factors.